What is the history of quality and how is it related to healthcare sector?
Okay, that's a good question. But before understanding quality, we should know what are the milestones in the history of quality. So the quality initiatives began more than 150 years ago with Dr. Philip Ignace Semmelweis, who initiated hand washing where he was working. So that was the first initiative taken by doctors to improve quality in hospitals. But real data-based quality evaluation, quality assessment and quality management in hospitals started in the early 20s in 1927. So, I will just write down the timeline of the quality route that we took over the period of time, and I will explain it to you what are the activities that we did during those years. Okay. So, that is 1927, then it is 1945 to 50, okay. Then it is 1951, then 1985, okay. Then 1987, okay. Then we come to 1994, and then 1996 and 2005. This is the milestone of various initiatives that we took during those years, but the major contributions were given during these times of the year. Okay. So, what happened in 1927? In 1927, the first data-based quality assessment and quality control systems were started by James SHEWART by using control charts. Control charts. Okay. The first thing what we developed was the control chart. Okay. And what is a control chart? Control chart means, suppose you want to improve quality of a process, and you know that the best quality comes at this level. Okay. But whatever you are generating, whatever a product or service is generating is either coming here or coming here. That means it is going away from what is your standards. Either it is going up or it is going down. So, we want to bring these things near to the standard. Okay. So, what we do is, we can never be perfectly 100% on the same level. So, we will devise an area where we can get maximum accuracy, and we will try to bring our products or services within that limits. So, there are two limits. This is the upper limit and this is the lower limit, and we will try our processes or procedures or protocols and put it in such a way that all the activities come within the limits. So, this is called a control chart. This chart will control your activity. If any of the activity goes above the chart, we will do a root cause analysis and bring it back to the control area. So, that was the first initiative. Okay. During 1945 to 1950, after the Second World War, Professor Edward Deming he was a person who was sent to Japan to reconstruct Japan after the Second World War, and he developed a cycle called PDCA, that is called plan, do, check, act. We plan something, we do it, then we check it, and we will act on it, and again we will bring it back to. If you do continuously the same cycle again and again, your process quality will gradually improve. So, that was done by Edward Deming. Okay. In 1951, in US, the hospitals, they wanted to improve the quality, and they started something called Joint Commissioner for American Healthcare Organization, AHO. So, this organization was responsible for developing standards for hospitals. You understand what I am saying? So, this was responsible for developing protocols, systems, policies and quality measurement tools for developing standards in the American hospital. That was in 1951. Okay. Then in 1985, ISQA came into being. ISQA is an international organization. ISQA is an international organization, that is an independent organization that is responsible for assuring quality in all sectors, okay, especially the healthcare sector, right. And ISQA was taken up by various countries, various organizations, and they started developing their quality systems based on ISQA. Okay. In 1987, major changes happened. One was the coming of ISO, and second was the coming of Six Sigma. Okay. ISO and Six Sigma. They both came in the same year. Okay, you are understanding? So, what is ISO? ISO is International Standard Organization, and those organizations create certain set of requirements, and we need to follow those so that we can achieve this certificate. So, when an organization follows those requirements, it improves the standard, and that is assessed by the organization, and they are given a certificate, right. That is ISO. And Six Sigma is another methodology that was brought by Motorola company, and it was taken up by other companies, especially GE and other companies, and now most major international companies follow this methodology. This I will tell you in detail. Okay. During this time, during the 1950s, another thing that came up was called Lean Sigma. This was brought by Toyota. This was brought by Toyota company. Okay, right? That is Lean Sigma, right? And as this progressed over the period of time, the healthcare sector needed something that was their own. Okay, so in 1994, another organization started, that is JCI. JCI is an offshoot of JCHO. JCHO is for American hospitals, but JCI is Joint Commission International, that is for all the hospitals all over the world. Any hospital can take up this. They can understand the standards, processes, protocols mentioned in JCI, and if they implement those things, their quality can improve, and that they will be assessed by this organization, and they will be given the certificate. Is it clear? And in 1996, India started its own quality management programs, and they brought in Quality Council of India, it is QCI. So, QCI is for all organizations, not for health sector alone. It can be in any organization, but in QCI there is one area that is called NABH, and NABH exclusively for healthcare organization. You understand? So, the beginning in the mid-19th century, hand washing was the first step that we took in improving the quality, because we did not have much idea about the disease process. But as we evolved over the time, the industrial sector took up quality processes, mainly the automobile industry and other manufacturing industries. They brought in these quality systems. So, that was the control chart, then the PDCA cycle, the Lean Sigma, that was part of the automobile industry and other industries. Okay. Companies like Motorola, Toyota, and GE, they brought all these changes. But the healthcare sector took up these initiatives, and they brought in things like JCHO in 1951, the ISQA in 85, ISO and Six Sigma. That is also in the industrial area, but later the healthcare sector also started taking it up. In 1994, JCA came as an international part of JCHO. In 1996, QCA came as part of Indian government's initiative, and in 2005, NABH was brought in exclusively for the healthcare sector. Is it clear?